Gotcha. That's the home run. Welcome to the office. Hi. How's it going?
Good.
What's your name?
Dylan.
Dylan, nice to meet you. I'm Dr. Rahim. Dad?
Hi, Lon. Nice to meet
Lon,
you.
nice to meet you too. So tell me, what brings you guys into the office?
The reason why I brought Dylan in here is because I noticed that when he's running, his gait is off a little bit.
Okay.
We believe that maybe some of the reasons why is because when he's playing soccer one time, he was trying to kick the ball and he fell on his bottom.
Okay, are you right-footed, left-footed?
Like for kicking?
Yeah, for kicking.
Usually more right-footed.
You kick with your right foot, your right leg? And are you right-handed or left-handed?
Right.
Right. And you said, so when you noted he was kicking, he had a fall or he was off balance?
I think he was off balance. I wasn't there that day, but all I was told is that he fell on his back.
When was this?
I think it's been a couple of years now.
A couple of years.
Yeah.
And since then, what's happened?
You know, I noticed that he can't really kick that high. He has trouble trying to do that, and when we try to do exercises with him, he has, you know, he struggles a little bit.
How's that? Trouble in what way?
Um,
What do you want to do better?
not, well, I would like to touch my foot because usually in PE I wouldn't be able to touch my foot like my friends.
Okay, it hurts your back to touch your feet?
Yeah,
Can you show me what you're talking about? Can you
like
stand
if
up?
I did this,
Yeah.
does it work?
And does it hurt somewhere when you do that?
If I like go farther, it does.
Where does it hurt?
It
It hurts back here in your back?
Yeah.
Does it hurt at the lower back or it hurts a little higher?
And it hurts like right here.
Okay, so where he's pointing at, do you mind if I just open this up a little bit, please, so we can see? So this is his sacrum here, okay? His sacrum is here, and he's complaining of right around L5 sacrum area. More on the right side, more on the left side, or in the center?
More on the right.
More on the right side. Okay, have a seat, please. So that's another thing. So one is kicking. You notice his gait is off a bit.
Right.
Okay, and when was the first time you noticed it? Was it that a couple of years ago at soccer or even earlier?
You know, I can't really pinpoint if it was even before that point in time, to be honest with you.
Okay. Did
But
you watch a video of that kid who had a soccer injury?
Yes.
Yeah, okay.
That's one of the reasons why I was like, oh, okay, this is perfect.
By the way, he's doing very well.
Yeah, I think I've seen a follow-up video on him, yeah.
He's doing very well.
That's one of the reasons why I brought him in.
Okay, right on, Dad, right on. All right, so what we're going to do is this then, okay? We're going to go over your x-rays. I'm going to tell you what I see.
Okay, perfect.
And you're telling me there was no other slips or falls you remember of him growing up. Oh, last question. Sorry, you wanted to say something. What did you mean?
My back is hurt like 2 times after the soccer. When I was
And Cub Scouts.
in Cub Scouts, I was trying to do a roll, but then when I did the roll, my back started hurting.
When was that? After soccer?
Like 1 year after.
Okay, so, and it's more on the right side, you're telling me.
Well, it feels like it.
I heard he did a roll, but he didn't tuck his head,
Okay.
and then he hurt his.
And he hurt his head.
Yeah.
Okay. So we're gonna do a few things. I'm gonna check you out, but actually before I do, a question.
Yes.
C-section or normal delivery?
C-section.
C-section because by choice or there was some issue?
There's some issue.
Okay.
And I have one more question.
Yes. What is it? Talk to me.
When you help me, will it sting or?
I don't know. It's not a matter of sting. You may feel nothing. It may be a little spicy, like you had a little bit of black pepper or something. You ever eat a spicy chili in the food by accident?
I think I have in noodles.
You've had a little chili every once in a while, right? And it's spicy for a little bit, but then it goes away, right? Yeah, it's kind of the same thing. Maybe. I don't know until I examine you. But I will ask for your permission before I adjust you, okay? Deal? Cool. Let's go over the x-rays. Let's see what we find. Now, you're kind of in between. I have a baby spine, but you're not a baby. This is what our spine starts like. Okay? But that's not you. You're in between this and this. This is a full-grown adult spine. Now, for 10 years old, your body is still forming. Dad, he has growth plates, growth centers, and these are still forming. And if we have alignment issues, and it can be affecting the growth centers, then what happens during development, they could grow a little bit different than what they should.
Yeah.
Okay, that's what we're going to go over. And we're going to go over this one first, and we're going to look, I'm going to zoom in on his foundation. We can see there's a little bit of a curvature issue here, right? You can see there's a little curvature issues, and he's getting a little, it's starting here, then it's going this way, and it's going that way.
Right.
But the question is, let's look at the foundation and see what's happening. Let's zoom in, and let's talk about it. And you can actually see his growth plates still. You see the growth plates here? You can see the growth plates here, you can see the growth plates here, you can actually see the growth plates here that the iliums haven't fully fused, right?
Mm-hmm.
But can you see the difference between this side here and that side there?
Yeah. One's
Right.
higher than the other.
One's higher than the other. Can you see how this growth plate is forming here?
Yeah.
And how is this one forming? It's a little bit different.
Yeah.
You see that, yes? You see there's a little bit something going on in this bone here. You can see a little slight lucency there. This side is okay, right?
Yep.
So something did happen on his left side. Something looks off actually on his left side.
Okay.
Okay?
I think I slipped in soccer when I was kicking the ball.
Okay. Do you remember slipping on your left side, Dylan?
Yeah, I noticed something like when I was trying to the next day, when I was trying to stretch my neck like this, then I noticed something was kind of wrong.
Something was wrong in your neck?
No, I just something was different.
In your whole body?
Yeah.
Okay, and that wasn't the same time when you fell, right? It was a different time? Or it was the same time?
What do you mean?
The time that Dad was saying when you kicked the ball and you fell, is that the time you're talking about, or was there another time?
That's the time I was talking.
That's the time you're talking about, and you fell on your left side.
Yeah, like
So you were kicking with your right and you fell on the left. That makes more sense. Okay, all right, cool. So this is what I need you to see now. If we look at the shapes, let's look at the shapes. Now, the shape of the bone is telling us how the alignment is. You see how this side looks thicker, this side looks thinner?
Yeah.
You see how this side looks a little bit higher, this side looks a little bit lower? So let's look at the numbers and let's see what they mean. And there you go. Now this makes a lot of sense. Okay, so he's got a few things going on here. We have an AS2IN12. We have a severely rotated left pelvis. We also have a left sacrum issue. We have a drop sacrum on the left, so he has that sacrum that he fell on. And this, I'm going to put it together for you in a second. We have a measured difference of 5 millimeters. If I correct the pelvis first, I'm going to make the leg worse. So the answer is not in his pelvis. Okay? We will have to address that at a later time.
Okay.
The answer right now is we got to get the sacrum forward and up.
Okay.
That's number one. If I adjust ASIN, look, it's up and in. If I bring it down and out, it's going to make this go down even more. So we have to first stabilize the sacrum and get that up as much as we can. He's young. Should, depending on how he adjusts, we should be able to do it in a little bit, not this lengthy period. And then from there we re-x-ray him, see what changes, and then decide on the next course of action.
Okay.
Okay? That's kind of the way I see it with
Okay.
him. All the other stuff above is all secondary. This is a foundation case. This is a fantastic example too. And just like you saw the boy who had that soccer injury, tailbone, who threw off his growth centers, who threw off his ankle, he fractured his tibia. The tibia healed beautifully, but all those alignment issues were there.
Yeah.
And you know, Dad did a great job by bringing you in, so hopefully we can change this, you know, from things from getting a little out of hand down the road.
Yeah.
Okay. Dad, does that make sense?
Yes, makes sense.
Dylan?
Not really.
Let me show you. So this is what's happening. This is your left side. This is your tailbone. So I'm talking about your left pelvis. Your left side goes up and it turns in this way. Your sacrum, your tailbone goes like this and it goes down. So the overall effect is he wants to go to the right side. And that dropped hip is what's causing this curvature, slight curvature issue that he's having. So it's getting a slight curvature to the left, and then it's trying to come back to neutral. But here's what's kind of getting me right now. This, whatever happened, definitely affected. This is different from this, these growth plates, these growth centers. So it's almost like we need to take this tailbone and we need to bring it up. Okay? And it may be a little tiny spicy for just an itty bitty second. Maybe. Okay? So we talk about those tailbone injuries and falls and nubs. And his overall effect is pretty decent overall. But there's something a little bit off. It's very subtle. S1, S2, it's S3. S3 is slightly open in the back and slightly forward on the bottom. So it's doing this. It's just tilted like that. So that's probably the one, S3, maybe even S4, okay? It's very light, it's very subtle. Do you see what I'm showing you, the piece? This one is fine. This one is open in the back. This one is this is open in the front, but it's slightly tilted. But we still have this beautiful, smooth appearance, just a little bit there. Okay, let's get started. Okay, so you can see this dimple is lower, this dimple is higher. You can see how he curves to this side. Okay, and go ahead and walk towards the corner, please. Just regular walking. Is that how you walk? Swing your arms, just walk normal. Come here and give me a high five. Give me a high five. Cool. Can you go over there and tap your sweatshirt? Is that how he walks then? Side to side?
Yeah.
Okay, come over here, come back. Turn around. Dad, you want to go on that side so he can high five you?
Okay, sure.
Yeah? That'll be better. That way he's got a target.
Okay.
Go ahead and high five Dad. Come over here and high five me. Good job. One more time to Dad. Alright, so what's happening here? Come over here and have a seat. Perfect. So here's what's happening. He's walking like this. There's no movement through his SI joints. So instead of getting this motion this way, he's just going side to side like this. That's what we need to correct today. Okay? Let's go ahead and run the meter on his back and let's see what we find. And let's go ahead and see what we have. Head down, please, Dylan. Head down. Good. And we're getting pressure C1 up top, left side. Am I tickling you a little bit?
Yes.
T7, left side. 5 points. All of this is coming from down level. There it is, Dad. Am I tickling you?
No, it now gets hurt. It hurts.
It hurts down here? Okay. S3, left side. Okay, let's take a look. Now, let's go ahead and palpate. You can see this, Dad, this is swelling.
Yeah.
Okay, this is the tailbone injury. Back slowly towards me, slowly. That's number 5. Does that hurt?
Not really.
How about S1?
Kind of.
How about S2?
A lot.
A lot. How about S3?
Ow.
Yeah, S3. So S3 is what we're seeing. Scoot back for me, please, Dylan. Now with Dylan, we're going to need to be quick. We're going to need to be light and quick. 4, 5, 6, 7. Tender when I push there. Does that hurt?
Yes.
Can you uncross your legs, please? Thank you. Does it hurt more when I push here or here?
There.
7. T7. S3. 4, 3, 2. Does that hurt when I push there on the left?
Yeah.
Does that hurt when I push on the right?
Not really.
Good job. Look straight, turn left, turn right. Did you guys fly or drive?
Right.
Yeah, he's tight on that right side. C1, T7, left, S3. So we're gonna start on S3. We're gonna do S3. We're gonna need to torque it up to get that sacrum up on that left side. PL, P2-L, S3 with a little bit of torque. How's that? It sounds kind of fancy, huh?
Kind of.
Yeah, you ready for me? Shall we get started?
Yes.
Okay. Right there. And we're going to actually do this as a push. Push-pull. We want to torque up this way. Nice and easy. Nice and easy. Come forward. Gotcha. That's the home run, Bubba. Did that hurt?
A little.
A little bit? A little spicy? Okay, stand up for me, please. Let's walk. And I'm going to open your gown in just a second. You keep walking. Before I open the back of your gown, keep walking. And why don't you tell us if anything feels different right now?
Well, somewhere. Feels a little different.
Okay, keep walking. Good. Keep walking. Come over here, turn around. And let's see. Let's see what happened. Well, what do you know? All right, go ahead and walk over there, please. Walk. Hey, Dad.
Yeah. I noticed it a little bit, yeah.
They're moving up and down now. Good stuff. Keep walking. Pretty cool. Come back over here, have a seat. Let's retest. Back slowly towards me. This is number 5. Do you remember this? This is S1. Does that hurt?
No.
This is the one, S2. Does that feel different? Does that hurt?
No.
This is S3. Does that hurt?
A little.
And S2?
No.
Pretty cool, Dad. Pretty cool. You ready for more?
Okay.
Come on.
Can I take off my mask?
It's
Yeah, go
okay.
ahead.
Is it okay, Dad?
Yeah.
Okay, you can take it off. There you go. You ready?
Yeah.
1, 2, 3, 4, 6, 7. T7, nice and light.
Oh.
Nice. That's the home run. Gotcha. And let's walk. Walk fast now. Check it out. Uh-huh.
I noticed that I'm walking a little bit faster.
That's right.
That's one
It's-
of the problems. You
What?
walk and run a little slower than the others.
What? I think we got some power on. Boom. Yeah, he's smiling. Keep going. Now we got to do the penthouse. You ready for the penthouse? I have to do the neck now, okay? It's light also. Relax there. Is that okay on your chest? Okay. Can I have you uncross your legs? There you go. And this one's going to be nice and light. Come here. Hi. We're doing a C1, nice and easy. Left ear down.
Ah.
Just like that. Home run. A little spicy?
Yeah.
All good now? Stand up and walk it off.
The neck feels a little weird.
Feels a little weird? Let's walk several times, okay? Feels a little weird how?
Like the neck. It is.
The adjustment or after the adjustment?
After the.
Okay, can you walk some more for me then? Walk several times and let me tell you what's going to happen. You've been used to being tilted for a little bit, okay? Now I'm straightening you up. I'm straightening out your spine. And we're getting the pressure off, so it should be a lot easier now to move. And while you're here, Dad, make sure you take him out, go to the beach, go to the park, just walk, be a kid.
Okay.
Okay? Is that a little different now?
Yes.
Can you touch your toes?
Well, I can't touch my toes all the way.
But does it feel better on your back when you go down?
Yeah.
It does, right?
Yeah. Because before I felt like my back was like pulling me back.
And now when you do it?
And I don't really feel it at all.
Good stuff. Have a seat. Now you get a buff and polish. Even the kids get the buff and polish. This is vibration. Does that feel okay?
Yeah.
Cool. Sit up straight. All right, Pops, you can help out. Come over on this side, please. You're gonna hold his leg here, both hands. Face me.
I'll face you.
Yes, you've seen this, I think.
Yeah.
Hold firm here.
Okay.
I'm setting his ankle. Are you ticklish?
Yeah.
Are you a little ticklish? Hold him.
Oh.
Spicy. Other side, please. This ankle's a little more swollen, okay? It's just gonna be quick. AS talus, drop. Relax. Relax the foot the best you can. Good. Nope. Let's do the board. You can put your sock back on. You ready for Maul? Sound is the board, not your foot breaking, okay? Whoo! Fourth, metatarsal base. Stand up and walk it off. Good stuff. As you're walking, I want you to tell Dad what's different, not me.
Now my foot's feeling different.
Better?
Yeah.
Good.
My foot feels like it's able to move a little bit more. Yeah.
A little bit better, right?
Yeah, before I feel like my foot wasn't like it was a little stiff, but I didn't really notice that.
Feels easier, right?
Yeah, I just remember.
Come over here, squeeze my hand. Squeeze hard. Squeeze hard. Squeeze hard. Relax there. A little bit on your elbow. A little bit on your elbow. That's it. You have any questions for me?
Not really.
Welcome to the office. Nice to meet you. Dad,
Yes.
welcome.
Welcome.
Okay, any questions for me?
Not at this point in time.
Okay, so we're clear on what we're doing.
Yes.
All right, guys?
Did it hurt, Dylan?
No.
Yeah.
Tell them, did it hurt?
No.
Didn't hurt, right?
Yeah.
That's what I noticed from the video. None of the kids went home crying.
But you see my adults crying. You see my adults screaming, right? That's not me.
Yeah.
That's them trying to let out that stuff.
Yeah.
And sometimes it's a little spicy, but I don't think it was too spicy for you two. I think you did very, very, very well. I'm very proud of you. Bump it.
And I'm glad I brought him in sooner than when he's like 20 years old.
Okay.
Yeah.
All right, Dad.
All right. Thank
Enjoy
you.
your day.
Appreciate it.